critical thing for rural women is to make sure that they're looking after themselves. As the expression, to make sure you've put on your own oxygen mask before you help other people. Being agile, not fragile, really means that you've got that, I guess, a suppleness and an ability to sway in the wind and not be blown over. I think it's important that we actually learn skills and techniques for managing the feelings that can sometimes be quite overwhelming, particularly when you're going through change and crisis.
In crisis there is opportunity. I mean, the classic example of that, I think there was more millionaires made in the Great Depression than any other period in history. Having something to strive towards and having that sense that you're moving forward with your life is very, very important for your well-being.
This webinar series is an opportunity to get some new tools, but also to look at, are you maintaining the tools you've already got? How do you be in a position where you can take advantage of what the opportunities are coming out of a crisis?
Not only giving people great information about well-being, but also giving them some great information about how to improve themselves professionally. People have shown remarkable agility to deal with extraordinary demands, but it's also important that while people are doing that and running on full revs, that they are looking after themselves at the same time so they can maintain that resilience over time.
I think one of the important things about this webinar series is that the people involved understand rural Queensland, they understand rural people. You can have privacy, you don't need to identify yourself when you're asking a question. There's lots of opportunities, but you need to look after yourself so that you can actually take advantage of those opportunities and be in a position to look after the people around you and make sure they're ready for them too.
So tonight is all about exercise, and we are so happy to have you guys joining us tonight. And I think there will be some wonderful questions and answers at the end of this, and we're more than happy to speak into some very specific areas if you guys will. I'm going to start off tonight talking more from a psychological point of view. And then Jacob's going to talk in from the physiological point of view. And it all ties in beautifully together. So why exercise? You know, I put up some of these funny slides up here. I don't know if you can see the one on the right. And I think someone said earlier that they exercise so they can have cake, and as that meme says there, so they can have some wine there. There's lots of reasons why we exercise. I'm sure you guys have heard lots of different reasons, and you've probably heard the saying that you're only one workout away from a good mood. And so tonight we're really going to take a little bit of a dive into why exercise has been touted as one of the cure-alls for a range of different things, from both psychological interventions as well as physiological. So I just want to preface it with all this stuff is essentially about trying to make ourselves a priority. You know, that we really want to make this a fun and enjoyable little exercise for you guys to listen to, and everything that we do around exercise, if we can make it fun and enjoyable for yourself, then we can make it sustainable as well. There's no point just trying to smack out a crazy big exercise regime and it's not that fun, and therefore it's not going to be that sustainable. So the benefits of exercise. Well, firstly, we feel good, right? We feel good after we do some exercise. And we'll look into the components of how and why we feel good in our mood after we exercise. We also get some sleep quality benefits. We know that we sleep better after we exercise, both probably because we're a little bit tired afterwards, but we'll look into how exercise affects our sleep-wake cycles. It reduces stress. A little bit of good stress can help reduce some of the bad stress. And 2020 is turning out to be a relatively stressful year compared to some others. So I think it's a really good time to have a look at some ways that we can reduce stress. Memory exercise can help lower our risk for different cognitive decline with dementia and Alzheimer's. And we can also think a little bit more clearly and have cognitive benefits from exercise. Jacob's going to talk into a little bit more about how exercise reduces the risk of chronic disease, in particular heart disease. And I'm going to have a little bit more of a look into how it's one of the most effective treatments for depression and anxiety. So, why do we feel better after we exercise? Well, firstly, we were designed to move. I'm sure that a lot of you guys out on properties and whatnot, you're moving around so much, and you guys might not feel this as much as other people, but when we sit around and we get a bit sedentary, we feel that we need to move, and that's because we were literally designed to do that. And so what actually happens is we start to see some structural changes in the brain that is very similar to psychological treatments. It's not exactly the same, but it's quite similar. So really, sort of a goal that I have in mind for us today is to understand the power of exercise. And a part of that is to understand the reasons why that we use it in psychological practice. And so really what we're looking at is, in some of the research shows that if, for example, we were to treat a person with depression, we might use some medication to treat that depression. But a lot of the research shows that some of the best outcomes are when we use exercise in conjunction with that medication, because it has very similar effects on the brain. And also, I think it's a wonderful opportunity to enjoy some me time, some time to work on on ourselves. With the stress of everything going on, some people have got young kids and, need to muster, and there's lots of stuff going on. And like what we heard in the intro, that we need to put our oxygen mask on first. And doing some exercise is a way that we can put in some time into ourselves. Alternatively, you could use it as a social outing if we are close enough to some friends, or you could use it within our family. It's a very good way to connect with our loved ones and with our friends. We can do sort of an informal type of exercise, but I think it's a wonderful way that we can connect with friends and family and get the benefits of exercise in a collaborative sense. And as I said before, some stress is some good stress is good overall. And we'll have a look at how that works. So there are three main ways exercise affects the brain. We're mainly going to look at the first two, okay? So serotonin is a neurotransmitter, and we'll look at, that's the main neurotransmitter that is affected in the brain from exercise, and we'll have a look at how that works in there. Endorphins. I think a lot of people probably have heard of the word endorphins, but might not know exactly what they do or what they are. And thirdly, we have neuroplasticity, which is a really funny, weird word of essentially meaning structural changes in the brain. And that last one is important because when we're doing, say, if we're looking at interventions within psychotherapy, essentially we're making changes in the brain. And a similar type of scenario happens actually from exercise. So it not only affects our different chemical levels in our brain, but we also see some structural changes that are very beneficial and very protective against stress and cognitive decline. So serotonin. Serotonin is a neurotransmitter, And it has a lot of jobs. It does a lot of things in the brain. And really, one of its main jobs is to regulate mood. And so when we have increases of serotonin, we have an overall sense of well-being and happiness. Now, if we're looking at from maybe more of a clinical point of view, one of the independent risk factors for the onset of depression is low serotonin levels. And interestingly enough, the medication that is most commonly prescribed for for individuals that have been diagnosed with depression is serotonin medication. And that's really, really important because, as I said, when we're looking at giving medication, and that's literally increasing, well, in a different way, but it's affecting your serotonin levels. And we've got exercise on this other hand that also increases our serotonin levels naturally. Serotonin also plays a role in regulating our sleep-wake cycles. And so we see that as well with individuals that are chronically depressed, is that they tend to have some issues with sleep. And this is because of the low serotonin levels primarily. So we can sleep better, and that's part of one of our pillars as well. So we can increase our mood, we can have our sleep be a little bit better, and also plays a role in appetite. So if our appetite increases, then we're able to get lots of wonderful nutrients into our body, and maybe eat that cake and have that wine as well. And as I said before, we see that with low serotonin levels, it can be linked to depression. Endorphins. Endorphins are our feel-good opioids. So yes, they are part of the opioid family. Yes, they're addictive, but in a good way. So essentially, the role of endorphins has been they essentially minimize the discomfort of exercise, and they block the pain. And you could probably think of the reasons why this was important back in the day, where you might be running away from a saber-toothed tiger and you needed to run for a long period of time. And so the body's like, hey, here you go. Here's these opioids that are naturally produced in the brain, and they can really just make everything feel nice and easy, and you can keep running away and get away from that tiger. So we then get the benefit of that today. And so when they are released in high quantities, they're sort of like this euphoric, really high, heightened experience. And one of those phenomena we have is in runner's high. And so some of you may not have heard of runner's high, but it's an experience that some long distance runners have, where they end up having quite a large amount of endorphins released. And it becomes quite addictive. They really quite enjoy it. But the good thing is that we get the positive mood and the overall enhanced sense of well-being for a long period afterwards, because it takes a while for that to flush out of our system. And one interesting example where I saw this firsthand was I was actually over in Hawaii, in Kona, for the Ironman race. I don't know if you guys have ever heard or seen of the Ironman race. It's I think the world record is 8 hours, and it's a swim, it's a run, it's like a triathlon on steroids. It's crazy. And some people take over 12 hours to finish it. But what was interesting was the very next day, there were so many people running that ran the race. And when we were looking at it, they were running the next morning because they were so addicted to getting their runner's high that they felt that was just part of the process that they did. So that's probably maybe going a little bit too far, but we can start to get a sense of how powerful these endorphins are. And we can use them to make our lives a little bit more enjoyable, and we can get that overall effect of the positive mood. So overall, our take-home message here, and Jacob's going to go into a little bit more specifics of the different type of exercises. when we look at seeing these benefits from serotonin increases, endorphins, and neuroplasticity, we see those benefits from aerobic exercise, which just means running. Essentially, it means you need oxygen to keep doing that form of exercise. So what the research shows is that if we can do 20 minutes of aerobic exercise, that can be one of the greatest activities you can do for your mental health and well-being. So you can go for a run. You can, ride a bike. Stationary bike is a really easy way we can get access to these incredible benefits. Quick paced walk, essentially anything that increases your heart rate. And if we can do it for a prolonged period of time, then that would be most beneficial. And if we can make it a habit, there's a lot of interesting research around. You get a bit of a reward each time you do something, and you tick it off, and that's dopamine. That's sort of our conditioning reward system in our brain. And so by doing something for yourself and making it a habit, it actually enables us to do more habit forming endeavors as well. So other things that we're trying to form into a habit become a little bit easier because we've ticked off this and we've got a little bit of positive effect from doing something that we set out to do. And we can start small and build our way up. We can do 10 minutes of timed exercise, maybe 3 times a week. There's maybe a little bit of a challenge there. But just some final considerations. Maybe get a checkup before launching straight into an exercise program. Everyone is different. Everyone has different physical conditions. Everyone's got different mental conditions. And I think it's really important to, if you've got any pre-existing ailments, any pre-existing conditions that might be preventing you from doing exactly what type of exercise you want, get a checkup and see what is most beneficial for you. Building up gradually, I think, is key with adequate rest days. I'm sure everyone's probably had some New Year's resolutions and they just jumped into it gung-ho and it didn't quite last too long. So I think tying into making it a habit, it's important that we get gradual reinforcement by doing something small so it's achievable. And we get that wonderful benefit of we've achieved it, we've ticked it off, well done, and then we can build up from there. So building up gradually, nice and small, and then having some rest days. We've got to be able to recuperate after our exercise. And finally, finding something that's right for you. So you don't need to be wearing your Lycra and joining a gym if that's not for you. Exercise is different for everyone. And if we can find your thing, then that's the way to go. So just some final considerations when looking into forming a new exercise routine. So that's it for me, guys. I was hoping to have plenty of time to chat in the question and answer time afterwards, but I'm going to throw over to Jacob and he will share his exercise physiology slides now.
Yeah, I'm just going to pull those ones up now. Did we want to just go straight into my presentation, or did we want to do a quick little Q&A with Tom?
Well, we'll do the Q&A in the end, Jacob.
Yep.
And then it gives everybody opportunity to put some questions in the chat too.
Yeah, beautiful. Okay. Just trying to open this one up. You see that one there? Hope so.
Yep, we can.
It's all clear? Okay, cool. Alrighty, so thanks, Tom, for touching on some really good points there. And I think that's really enlightened quite a fair few people about, that exercise does have a pretty big role with not only the body, but psychologically and with the mind. So thank you. Now, transitioning onto my side of the story, we're going to be touching a little bit more on the sort of physical benefits of exercise. And more specifically, today's focus, which is going to be the effects of aerobic and anaerobic exercise on coronary heart disease and type 2 diabetes and the prevention of these health conditions. Now, before we go any further, I just want to clarify a few terms and words that are going to be thrown around throughout tonight's presentation. Anaerobic exercise and aerobic exercise. Two very, very different forms of exercise. Now, aerobic exercise is basically, it's exercises that are rhythmic, they're continuous, and they're performed with large muscles of the body. So like Tom said earlier, you know, aerobic exercises are things like walking or a brisk walk, a light jog, stationary bike or going for a bike ride, it could be rowing, hiking, all these sorts of things, okay? So they're repetitive, they're a cyclical, repetitive kind of exercise. On the other hand, on the left here, we can see a girl doing the battle ropes, and this is what we would call, this is an example of anaerobic exercise. So this is sort of exercises that they're going to be quite high intensity, and they're going to be quite short in duration. So things like plyometrics, like maximal jumps, high intensity interval training, which I'm sure a lot of people may or may not have heard of. So things like this and sprints, those sorts of exercises. Okay, they're going to be quite short in duration. Now, this is actually answering one of the questions I saw earlier popped into the chat. And I kind of want to put it forward to everyone, just have a quick little discussion among yourselves, and perhaps you can post into the chat what you think the difference between exercise and physical activity is. I'll give it a minute, just a quick discussion. I just want to see what everyone's sort of understanding of this would be. There's no wrong answers. Okay. There we go. Oh, just lost my chat. There we go. So I'll leave them up here. That way everyone can see them. Physical activity, choosing stairs, heavy jumping. Yep. Cool. Good answers. Might give another 20 seconds if anyone's got any cool ideas. Yeah. Good one there by Kristen. It's a really good example. Okay.
Hopefully everyone is reading the chat.
Can everyone see this chat on my screen? Hoping
No,
so.
we can't see that,
You can't,
Jacob.
okay.
So people either need to read or you need to read out the responses.
Yeah, I might mention Kristen. Her answer was that exercise is structured, and that physical activity is more sort of relaxed, general body movement or incidental. So the reason I wanted to, yeah, that's a good one. Working in the cattle yards all day, I could do up to 10 to 11,000 steps. That's a good one, Rob. So I think we might touch on that one. Look, the reason I wanted to discuss this is because quite often when I'm in clinic and I'm seeing patients, one of the first questions I'll ask them, gathering information, is, like, what are your exercise levels? How much exercise do you do? And quite often the response will be, like, I do plenty of exercise. I mow the lawns, I tidy the house, I do the washing, I hang the washing out, and that's really good. Okay, so it's excellent to see that people are quite active about that, but it's very different to exercise. Okay, those examples are physical activity. So exercise it's planned, okay? It's structured, it's repetitive, and it's sort of intentional movement. So it's an intention to improve health, theoretically. So it'd be things like I mentioned before, like going for a walk, riding a bike, going hiking. These kinds of things are exercise. Whereas physical activity, on the other hand, it's really any movement that one does. And it's kind of like those examples, like I said, mowing the lawns and things like that. A bit of a difference between the two. Now, this is a good way to gauge intensity of exercise. Okay, so when we talk about a rating of perceived exertion, What I'm talking about is how hard the exercise is. And this is completely independent to the person, okay? So this is how hard you feel like you're exercising. So if I looked at the scale and I said, you know, 0, so that's nothing. So you're lying in bed, you're watching Netflix, you're eating some popcorn, you're relaxed. You're doing absolutely nothing, okay? Moving down the scale to a 5, heavy, okay? You'd be quite well aware that you're exercising here, okay? You might be sweating, you're getting a little bit puffed, and you're well on your way to a more intense exercise. And if we look right down the bottom, a 10 out of 10, that's flat out, okay? That's like our anaerobic, which I mentioned before. That is high intensity exercise, okay? You probably wouldn't want to do this for more than 10 seconds. Now, I'm sure everyone's sitting there scratching their head asking why these conditions, you know, why choose coronary heart disease? Why choose type 2 diabetes? Well, I've chosen them for some very specific reasons. Firstly, coronary heart disease. It's the biggest killer in Australia. And it's shown on this graph here, okay? So not only Australia, but globally, coronary heart disease is the leading cause of death, which is quite scary. And it's been like that for the past 20 years. That's as much information as I could find. And it generally targets groups from 45-year-olds upwards, okay? Now, as for type 2 diabetes, yes, I'm aware it is not on the chart here, but it's not the fatality rates associated with type 2 diabetes that are of concern. It's more the prevalence among society. And it actually impacts or affects 1 in 11 adults, and 50% of people go undiagnosed. So it's quite concerning, and it is a preventable thing that we, you know, if we exercise and we take the right measures, we can avoid these sorts of things. So moving on to coronary heart disease, what is it? Well, coronary heart disease is basically referring to narrowing or clogging up of the coronary artery, and this is due to plaque buildup. So the coronary artery is one of the main arteries that feeds into the heart, okay? So if you look at the image on the right here, we can see a nice healthy artery. What we've got here is just nice blood flow and no problems whatsoever. Progression of the disease, we're moving to the second image, which is plaque buildup. And as you can see there, there's a little bit of an impedance to the blood flow, and that's going to slow things down a little bit, and that's going to reduce blood flow and unfortunately reduce oxygen supply to the heart. And then if we go to the full extent, which is a blocked artery or a quite well on its way blocked artery, that's when we're going to have problems, okay? And issues like heart attacks and strokes are going to be coming into it. So what can we do, or what are the causes of coronary heart disease? It's a mixture of controllable and non-controllable, uncontrollable risk factors, okay? And I've popped a couple examples there in the table. So things that you can change, these are our controllable risk factors. So things like being physically inactive, high blood pressure, high cholesterol, these are all things that are risk factors for coronary heart disease that we can change. And then unfortunately, there are some that we cannot have any influence over. So that would be family history, age, and ethnicity. All right, how can exercise help? Yeah, I've just lost my lost my slides here. So exercise. What I've got here is a perfect example of science at its finest, okay? Now these numbers that I've popped on the screen, these aren't from Wikipedia. They aren't numbers that I've made up for tonight's presentation. Okay, this is some serious research that's been done for a very, very large group of people. And what they did is they exercised for 12 to 52 weeks at a moderate or moderate to vigorous intensity. So let me just quickly flick back to our scale here. Okay, so we're sort of working around that 3 to 6 mark. Okay, we're well aware that we're exercising. Okay, we might be getting a little bit short of breath. So they did this for at least 3 days per week for 30 minutes. And what we found was major decreases, or very noteworthy decreases in our in some of these risk factors. So we saw decreases in our waist circumference. we saw improvements in cholesterol, we saw improvements in our fitness levels, and we also saw a decrease in blood sugar levels. So these are all risk factors that we are able to manage through the means of exercise. Okay. Speaking of sugars and blood sugar levels, type 2 diabetes, and I'm sure most people listening today quite well understand what type 2 diabetes is, but I thought it would be worthwhile at least redefining it and making sure everyone's on the same page. So basically, type 2 diabetes is a disease that occurs when your blood glucose or your blood sugar is too high. So basically, blood glucose is our main source of energy, and it comes from the food that you eat. So insulin, which is a hormone that's made in the pancreas, it acts like a key, okay? So it opens the gate and allows sugar to go into the cell. And this is in turn how we make energy. So that's how we do our everyday things. Now in type 2 diabetes, there's an issue with the insulin. So that key's not working, okay? It might just be jammed, it's not opening up the gate. And so what happens is we have, inclined blood sugar, okay? Which isn't good. That's what's gonna cause issues. So what causes this? Well, unfortunately, there's no direct cause. And similar to coronary heart disease, we've got an association of modifiable risk factors. So if you look to the right here on that image, we've got lack of exercise, we've got overweight and unhealthy eating, all three of which are controllable risk factors. And then we've got an uncontrollable one, like family history. So again, moving on to exercise. How does exercise come into this? Well, think about it like this. We said that insulin was like this key, okay? It's this key to the gate that allows sugar to go into the cell. Now, exercise is quite well a copy of that key, okay? So it's like you've gone to your locksmith and you've copied that key. Exercise will and has the ability to move that sugar from the bloodstream into the cell, completely independent of whether insulin works. So a good example of this is if I were to exercise, okay, I'm not type 2 diabetic, so my insulin's working fine, and I was to go and exercise with patient X, okay, and they are type 2 diabetic, and they've been type 2 diabetic for 5 years, okay? If we were to both exercise at the same intensity or at a given intensity, we would both see improvements in our sugars or our blood glucose levels. So it doesn't matter if your insulin works or not, exercise will improve that transition from the bloodstream into the cell, completely independent of whether that insulin works. So really, really cool stuff. I'm sorry to get a little bit nerdy with it, but I think it's worthwhile sort of talking about that sort of chemical pathway. Now, like my previous slide, the coronary heart disease, I've gone and done some research on aerobic exercise and how that helps with type 2 diabetes. And again, these numbers, they're not Wikipedia. I haven't found them on Wikipedia. I haven't found them on a bodybuilding forum, okay? This is science. This has worked for a very, very large group of people. So in this study, it was a 12-week intervention. They did cycling, walking, bit of treadmill walking / brisk walking, and they did it 3 times a week, 15 to 60 minutes each session, mostly sort of at that 40 to 60 minute mark. So basically doing at least 150 minutes of moderate intensity exercise. So going back to that scale, that sort of 3 to 6 range, and combined with some dietary advice. Now, that letter combination down the bottom in that table can be a little bit confusing. And I'm sure if someone knows someone with type 2 diabetes, you'd be well on your way to understanding what that means. But basically, HbA1c it's a measure of the sugar in the blood over the last 3 months, and it gives the practitioner or your GP a good idea of what's been happening. Okay, what's been going on with your sugars, and they found quite a significant decrease in that number through doing this intervention. And I think if you told or mentioned this to a diabetic, they'd be pretty well excited about how exercise could have this sort of change. So it doesn't matter if you're diabetic or not, like these health benefits can be obtained through exercise. So both through a treatment and a prevention measure, it's probably worth getting onto the exercise regime. Now, take homes for today, the big four, okay? And I think this might answer quite a few questions for some people. Firstly, duration, 30 minutes a day, okay? Mode, so what type of exercise are we going to be doing? Walking, bike riding, light jog, rowing, if you've got a beach or a dam or some sort of water near you. Frequency, how often do we do it? 5 times a week. And the intensity levels. Again, referring back to that scale that I showed, it's sort of that moderate to vigorous intensity. Okay, and that is it from me. I might pass on to the group and we can perhaps have a chat with some questions.
Thanks, Jacob and Tom. Eric, you might give me a hand here. There's a few questions that did come through, but we'll slip back up to Robin's. And I think she's referring to the runner's high. I'm actually just as intrigued as you are, Robin. How much or intensity of exercise to release these endorphins?
Yeah, great question. So what we've found, what we've seen is that with the higher intensity and the longer duration of aerobic exercise, both the more amount of endorphins are released, and also this protein called BDNF, which is a precursor to making the structural changes in the brain. So it's sort of a dose dependent thing that we see. So the longer the duration, the more higher dose of endorphins are released, which makes sense when we think about the purpose of those endorphins to protect us from the pain. If you start running a long period of time at a higher level, you're probably going to experience a bit of pain. But we can do that in a very nice, gentle way without probably doing the high intensity. We just probably start doing it a little bit longer.
Is it normal? I'm actually pretty intrigued about this. Can everyone get to this point, or is it this is for the elite athletes only?
No. Everyone gets this benefit. Everyone has the same physiological and psychological response to stress, and this is what it is. The body goes, "Hey, I'm under stress." In doing this physical activity, and therefore I need to release some chemicals to help me deal with this stress. And that's one of the real protective factors that we find from doing exercise, and endorphins is one of the main ones. And it's everyone has that same stress response. And so, but as I said, what we do see is a dose dependent effect. So the longer you exercise for, the greater amount of endorphins that are released.
Okay, I'm just going to scroll down. Erica had a really good question. How do you build new habits from not liking exercise to at least doing it, or even just, or at least do it or even like it? So I guess it's going back to that. What switches on up here? Like what actually gets you into this exercise mode?
Yeah,
you're excited. I want to.
Jacob, I'll take this one if you don't mind, mate. I don't take all of them. That's a fantastic question, because I'm sure a lot of people are sitting here going, well, Jacob's just said I need to do 5 days a week and I need to do 30 minutes. And that seems like a lot. And it does sound like a lot. And I think we've put a tip sheet together as well that Susan will distribute to everyone. But the key there that I wanted to mention, first and foremost, when we look at behavioral change, is finding your why. You know, finding what is your purpose of changing. If you don't have a purpose, it's pretty hard to initially start something and then maintain something. And the cool part about having the purpose is, first and foremost, it's you. It's you've come up with it, you've thought about it, and it's intrinsically valued to you, right? And so you work out your why, and then you can always go back to that why, that purpose every time. You know, Rob's done his 10K walking with the cattle, and he goes, why would I now go for a run or something like that? And it's going back, well, why do I want to improve my mental well-being or my physical well-being, my overall well-being? Do I want to be able to run around with my grandchildren whenever I want to? You know, do I want, maybe it's something that I have with my partner that I would like to, with my appearance, or maybe it's just I would like to be as well and healthy and well overall for myself. Everyone's different of their why. So that's what I would first say, is find your why, find your purpose. You can always go back to that. And then secondly is, as I mentioned earlier, about starting very small. If we can start small and tick it off, we actually get that release of dopamine, which is a neurotransmitter that conditions different behaviors, and it's sort of our reward system in our brain. Similar to, you know, if you're giving a dog a treat, they eat the treat, and they also get a release of dopamine as well. And so it's a very powerful way to almost like, you know, biohack your brain in a sense. And we can start that off by, you know, there's lots of research about making your bed before every day, and you get that little hit of dopamine. The same thing with our exercise, is that if we can do something small and we've set out a structure to it, and then we can tick that off, we get the wonderful feeling from the dopamine that we're actually making an effort moving forward, and then we can build up from there. What's probably less advisable is to start off with something huge. We can't achieve it. We don't do it. We don't feel too great about it, and then it all sort of plateaus from there. So those are the first two. Those are the main two things I'd suggest: finding out your why, what's your purpose for exercising. Start small and build up.
Perfect. Thank you. Perhaps this one's for you, Jacob, from Jill. If you exercise regularly for 4 months, then stop for a month, can you pick up where you left off, or are you better to go back to halfway and start again? It's a great question.
Probably relevant for the given global pandemic that is
yes,
well underway. But honestly, if I were to, you know, Jill, you were my patient, and you know, you were exercising for 4 months, and then, you know, for some reason you had to stop. I think there's a lot of factors that come into it. Quite often, I think if you do have that sort of rest period, and then you sort of recommence the exercise at that sort of intensity or that frequency, there could be a tendency to, I'm not going to say have injury, because I don't want to scare people off. But there is that likelihood of, you know, this is going to be a bit of a shock to my body. So if it were me making a recommendation, I would say, yeah, start back at halfway. You know, you've gone 1 month of not exercising. Let's just gradually build it back to where we were, and then hopefully we won't have that sort of relapsing stage in our behaviour, if that helps.
Yeah, and I think that's also really great advice because of the injury factors. The last thing you want to do, isn't it, when you're sort of getting back into exercises, to injure yourself, and then it's back to square one even more.
Yeah,
so.
Yeah, that's exactly right.
Another question for you, Jacob. How much is our resting heart rate an indicator of good physical health? And secondly, is there pre-diabetic symptoms that we should be concerned about or look out for? So there's a few questions.
A couple of good questions there.
Yes.
Throw me under the bus.
You want to go and get your textbooks first and then come back to us?
As for the resting heart rate, that's a big conversation to have. I could dive into, are you an elite athlete and are you sitting under 60 beats per minute? Because you might have what we know as athlete's heart, or all these sorts of things that could come into it. Generally speaking, you'd sort of want your heart rate sitting around 60 to 100 beats per minute. That's like the guideline that we look for. So as an indication for good health, honestly, I'm not too sure. I've seen some young athletes sort of sitting in what we would call bradycardia. So that's quite a slow heart rate. And that is because they are extremely fit athletes. And that's sort of like an adaptation that the heart has made in order to sort of facilitate their fitness. So if you're an elite Ironman athlete, I would say it'd be a dead giveaway. But for general population, yeah, I think it's, I wouldn't be too sure on how to answer that. And then
no, that's fine. Sorry, just before you go on, Bronnie asked that because smartwatches give us all this information.
Yes.
So maybe that's another conversation again about technology and exercise.
Yeah, that's exactly right. And there's a lot of factors. Have you just had a coffee? That's going to pump your heart rate up a bit. Are you stressed? Are you getting chased by a lion? Like there's a lot of factors that come into why is our heart rate at this point. But at rest, you'd want it 60 to 100. That's the general guideline. And then as for pre-diabetic symptoms, a bit out of my field. I think there's obviously symptoms of low blood sugar and high blood sugar, but unfortunately, I don't quite often see someone who would be unsure as to whether or not they're diabetic. That's usually a GP's concern, and then they'll refer on to me to treat.
Would you guys say that exercise is going to be so important with the lockdowns that are happening? Most of us are sitting here reading books, watching Zooming stuff, and if there really could be some programs put out for people, just to get up, what kind of exercise, minimal exercise would be useful, just to get the body stimulated and the brain doing something different.
Yeah,
definitely.
that's a fantastic idea. Yeah, and it would be interesting to see if physical activity has decreased during COVID, and you're probably right, it has. But what I think has also happened is there's been some wonderful developments through different apps and YouTube that you can do so much at home. There's YouTube channels that have got different workouts at the home. That's all body weight that you can do.
Oh, yeah.
There's yoga online as well as on apps. And a lot of people are going for runs. Again, with all the gyms and everything closed down. And I really encourage people to think outside of the box of, I need to go to the gym to make it formal exercise. Because you really got to, in terms of, making it sustainable, you got to do stuff that you enjoy, that you like doing. And we see that so often with people that get gym memberships and then they use it for a couple months and then they don't. So I think that this post-COVID era, I think we're seeing a lot of quite wonderful creative stuff that people are doing in their homes. They're squatting kids and babies and doing all sorts of funny stuff. So yeah, it's I think a lot more people are exercising less, but there's a lot more things you can do now with technology.
That's true.
I was just asking on the side while you're talking there, Tom, about whether people would like to suggest some apps that they use or any sort of tips that they use to keep their exercise regime going. Like I know personally when I was exercising pretty full on, like 4 times a week, exercise was my priority for the day. I made my appointments and my work around my exercise. That's probably, I had a autoimmune disease and I had to get myself back on track. So that way it became a priority. But when I asked that question, Jane came back and said, join McClymont off the track training. She's obviously very popular personal trainer in the bush. She uses a lot of bush stuff that she got lying around the place. So that's interesting. What
Yeah,
else
if
have
I
we
could
got here? Keep going.
Susan.
Yep.
I'll just make a quick comment on that because that jogged my thought about a previous question around how do I make this into a routine and start off. I think it's really powerful if you can structure, you know, the brain loves routine. And if we can put something visual that we actually write down, if we can structure our day, our week in terms of, you know, you've got your different important things that you're doing, but if we can visualize and write down some exercises that we do, not only is we're almost holding ourselves accountable, but we're also structuring our day around something that's important for us. And then if you can tick it off, then you get that added dopamine bonus as well. So if we can make stuff structured, we know what we're supposed to do, and then we can actually tick it off, that reward system kicks in, and we can make it more of a habit, and make it more habitual.
Okay, just we probably need to start wrapping up shortly. There's but a few more questions if we can, if just to go through them quickly. We've got one from Janine, like related to age. So, oops, just disappeared on me. Sorry. It was basically around 1 hour, 5 days a week for any age, or can you reduce this after a certain age?
Where was that one? Sorry,
take
Susan.
that one on. That was it was up further, but it was just repeated.
So if you 1 hour 5 days a week, is that for any age of recommended exercise, or can you reduce this after a certain age?
Yeah. So the guidelines would say, you know, 150 minutes to 300 minutes each week of that moderate intensity. That's sort of where they've seen a lot of the health benefits come from, and particularly with that sort of intensity, that moderate intensity. So can you back it off? You probably wouldn't want to, because you're then sort of going against the grain. You know, like I said with that research that I was showing earlier, there's a lot of information to say, you know, this is how much you need to do because these are the benefits that you could sort of obtain from it. And I don't think there's been enough research to show smaller amounts of exercise, because, I mean, you might be improving your fitness, but you might not be getting all those sort of benefits to, you know, to like your blood sugars and to the cardiovascular system. So ideally, if you can make it a habit and maintain that 150 minutes, ticking a lot of boxes off.
Perfectly. And just another couple, Robin, how can you tell if you are fit?
It's a good question. I know of a couple, but Jacob, you take this one.
Yeah, well,
is that a volley?
Bit of a handball. There's some good exercise testing that you can do. For instance, there's one called the Bruce protocol, the Bruce treadmill protocol. And if you were to come and see like an exercise physiologist, and you know, understanding how fit you are is an important measure to you, then yeah, we could definitely put you onto a treadmill, make a lot of sort of objective measures, look at your heart rate, back to that RPE scale, how hard are you working, and all those sorts of things, and also your recovery. So that there's science-based ways to understand how fit you are, and that's generally the approach that I take with patients. Yes.
And to reach that, going back to that level of fitness intensity, your scale that you had, to get to that level of between 3 and 6, could you just provide a few exercises that would get you to that level?
Yeah, definitely. So, yep. Like I said, it's very subjective. So for someone like, let's say Tom, okay? Tom, quite an athlete, he does a lot of exercise. Let's say Tom goes on a treadmill and he walks at 5 kilometers per hour with a 5% incline, and next to him is a 70-year-old female who doesn't do a whole lot of exercise, doing the exact same intensity, same speed, everything's the same. Tom If he was to place himself on that scale, I'd say he'd probably be around a 3. Okay? It's not super hard. It's not very difficult. However, let's say Mary, for instance, who's on the treadmill next to him doing the exact same exercise, might say, yeah, I'm working pretty damn hard. I'm probably about a 7 out of 10. So it's a very subjective measure. It's how hard you feel like you're exercising. So the exercise is going to be very dependent upon yourself. I couldn't say this will be more challenging. Look, there's definitely going to be exercises that are more challenging, but it's all up to you and how hard you exercise within that exercise, if that makes sense.
Yeah, and look, I think that actually finishes off the night well, because if there's any sort of doubt around exercise, there are exercise physiologists available in most or all over the state now. So seek out help to get a program that's just right for you. And so Tom and Jacob, thank you very much for tonight. It was I think everyone, we've taken home some valuable tips and information, particularly knowing, I think my biggest take-home message is that chronic disease is largely preventable. So it's, considering what we can do for ourselves, it's great. Even turning up to one of these sessions and learning about this information is a good start. And I say to Rob, just be careful of all your movements and motions and yoga poses over the cattle fence yards. I mean, the cattle yard fences.
Good to see you getting the steps in, Rob.
Yeah, he's getting more than steps in. But yeah, no, I think we'll put those tips up onto the website. And once again, guys, thank you, Outback Futures Northwest Remote Health, and again, Kieran, for facilitating this session tonight. So I bid you all good night.
Thanks for joining.
Thanks, guys.
Good night, everyone. Thank you.
See you.
Bye-bye.
Okay, thanks, bye. That was good. Now we should face.
The critical thing for rural women is to make sure that they're looking after themselves, as the expression, to make sure you've put on your own oxygen mask before you help other people. Being agile, not fragile, really means that you've got that, a suppleness and an ability to sway in the wind and not be blown over. I think it's important that we actually learn skills and techniques for managing the feelings that can sometimes be quite overwhelming, particularly when you're going through change and crisis.
In crisis, there is opportunity. The classic example of that, I think there was more millionaires made in the Great Depression than any other period in history. Having something to strive towards and having that sense that you're moving forward with your life is very, very important for your well-being.
This webinar series is an opportunity to get some new tools, but also to look at, are you maintaining the tools you've already got? How do you be in a position where you can take advantage of what the opportunities are coming out of a crisis?
Not only giving people great information about well-being, but also giving them some great information about how to improve themselves professionally. People have shown remarkable agility to deal with extraordinary demands, but it's also important that while people are doing that and running on full revs, that they are looking after themselves at the same time so they can maintain that resilience over time.
I think one of the important things about this webinar series is that the people involved understand rural Queensland, they understand rural people. You can have privacy, you don't need to identify yourself when you're asking a question. There's lots of opportunities, but you need to look after yourself so that you can actually take advantage of those opportunities and be in a position to look after the people around you and make sure they're ready for them too.